we have a great fear of trying to support and help men. There's a great fear of if I move to support men, it will look like I don't support women. When by supporting men, you're actually supporting women. You're supporting children. You're supporting the environment. You're supporting the animals by creating healthy men.
Dr. Steven Rissman, you are a naturopathic doctor and a professor of health at Metropolitan State University of Denver. Back in the day, you attended Bastyr University when it
Sure did.
was in Seattle before the campus moved to Kenmore. So I'm curious to know how you ended up at Bastyr.
Knew from early on as a kid that I wanted to be a doctor, and I worked in surgery when I was a young guy and through college, and got really discouraged with what I was seeing, and found something about naturopathic medicine. Did a little bit of work with a men's group, and found out something about naturopathic medicine. Went and visited Bastyr University there and fell in love with it. Said, okay, this is even with one foot out the door, going, I don't know, is this all right? Is this the right thing to do? I followed my heart, and that's where I ended up, and no regrets, absolutely.
And what time period approximately was this?
That was 1992. I graduated in 96, stayed and did a residency for another year at through Bastyr University, and then decided that I needed to return to Colorado, and so, but I maintain good connections with folks up in Seattle.
Tell us about what you've created that pertains to men and men's health.
For a long time, I had an interest, even before going to Bastyr University. I had started doing some men's work, connecting to other men who were looking at themselves and trying to figure out who they were, and et cetera. And that's how I really ended up at Bastyr. And while I was at Bastyr, I actually started a men's group, founded a men's group there in the program. And over time, went out and practiced, and was asked to teach here at Metropolitan State University of Denver. Within a year or two of doing so, I started to ask myself, we had a women's health class, but there was no men's health class. And I started to look around, and there was no men's health classes offered on any campus. And I then felt like that was a calling right there to utilize my training in naturopathic medicine, healthcare, to create a class. Yeah, the first class was 18 men and 2 women. It was quite an amazing experience to have a heavy concentration of men in one setting. And what I realized at that time was that a lot of men's health issues are really wrapped up in performative masculinity. Who are they as men? And their health behaviors, and therefore health outcomes are all influenced, or many of them are influenced by the cultures of masculinity from where they originate. And so I developed another class. At that time, it was men and masculinities, but over time, it became men across cultures, looking at the cultural influences, racial, ethnic, geographic, religious, LGBT communities, incarcerated communities, aging facilities communities, all those things which influence a man's health behaviors, health choices. And then I developed an anger in men class, which started off as a 1 credit class, and the dean quickly said, 1 credit on men's anger? I don't think so. So that became a 3 credit course, and it's something that I'm really proud of. What I found at the time was that there was no voice for men's anger. As a matter of fact, there were no resources. When I looked at what resources were out there, it was if you had been in trouble and you got court mandated to an anger management class, there was a resource for you. And one of the things that I have really talked about with that class is that We gave men anger as their only emotional language. That was acceptable. That was masculine. The rest, not so much. While that's softened and evolved a little bit over the years, it's as true now as it was 20 years ago when I started this. But now what's happened is we don't like angry men, where angry men are a threat. Men's anger is a threat. Instead of listening to men's anger, we instead shut that down. And so when we ask men about their anger in the anger class, the first thing is, I don't have any anger. Nope. Mm-mm. Which isn't, that's just not human. And then when you peer underneath the hood a little bit, what you find is, wow, there's a lot there, and there's a lot of fear about their anger. It is an amazing class. Students really do see who they are, and they see what happens. They see what we've done societally in terms of our response to men's anger. Later on, I developed Fathers in Health, looking at the father's influence on the health of a child, as well as what is the experience of fathering on the health of a man, both negatively as well as generatively, helping him to mature into manhood. And students love that class. They love that class because they often have to, well, I ask them to interview a father. It doesn't have to be theirs, but when they do, it's usually the father who's the one who can't wait to do that interview, because it's an opportunity for them to, under the guise of that homework assignment that you have to do, explain themselves and reveal a little bit about themselves. It's so powerful. It is actually one of my favorites. And then the Aging Warriors class, which I now find myself as over the years, and looking at what are the issues with aging men, and the huge issue, well, the huge glaring statistic is the high levels of suicide, because men are strongly attached to their work. And when that declines, when that is no longer, which is inevitable for all of us, who are they? Those classes make up the men's health minor. It's the only men's health academic minor in existence. And then from there, I've created a men's health digital badge. Digital badging is a micro credential. It's competency based. It's not necessarily taking a class, but a particular project in a class, as well as some other competencies that one would demonstrate. And that digital badge tells a future grad school or a future employer, hey, I have competency in working with men. So, for example, if a student is going to go into social work or into criminal justice, and they demonstrate, hey, I really understand some of the issues with men and with men's anger, for example, that would be a real leg up.
The idea of having a credential that demonstrates competency working with men and understanding men seems really powerful to me. We continue to struggle with this concept of some groups are considered marginalized groups or misunderstood groups,
Mhm.
and males as a class or men as a group typically don't fall into that. And I think along with that is kind of an assumption. If men have been in charge and if maleness is often the standard of things, shouldn't we just assume that people and systems understand men? And I have come to see that no, we should not assume that.
Hmm. I would agree with you. There's this sort of idea out there that men are just fine. That's a little bit of a problem. No, that's not the case. Look at our statistics. Look at the health statistics out there. Look at our engagement statistics. Number of men engaged in the workforce, the number of men engaged in an education or training program. But the other part of that is that, as Christine Emba likes to say, it's not a zero-sum game. That if we help one, we shouldn't help another. But the most important thing is, if men are thought to be, and this isn't always accurate, if men are thought to be the ones who are speaking the loudest, or maybe committing acts of violence, etc., well, doesn't it seem as if those are the ones that most need help? In other words, men, we have a system, right? And so if one part of the system is not doing as well, maybe we need to look at that. And what I am starting to really focus on is this assumption that men are broken, that men need to be fixed, and that is not at all the case. There is wounding, but the wounding comes from dysfunctional systems where we negate the emotional aspect of men, where we want to suppress men because we are afraid of their masculine power, which, true, has been used at times to oppress, to hurt other people, but masculine strength has also moved us ahead as well. And so we have to respect both. And I think that that's really important that we ask ourselves in our institutions, do we allow men to be men, or do we fear them and therefore suppress them? I think that that's an important conversation out there. Again, with this recognition that I don't think that men are broken. I can remember exactly where I was when I watched the movie Boys Town and I heard Father Flanagan, the statement, there are no bad boys. There's bad teaching, bad modeling, bad education, etc. Bad systems, as I just alluded to, but inherently we're innocent. And that innocence gets violated, and men behave the way they do because of their wounding. That's where a lot of my work, that the root of my work is.
You said, I believe in your earliest men's health class, you had 18 male participants and two women.
Yeah.
Since then, you've seen some demographic change. Now you have some of your courses are more women, and that's partly a representation of there's more women in higher education, maybe
Yep.
more women going into health type fields. But also, it's cool, it's encouraging that
It's,
women want to learn about this.
yep. It's really great. And so I've really welcomed that. One of the challenges with that is that when there was 18 men and two women, and there were days when the two women weren't there, it was a really interesting experience to hear men or to see men sort of unmask a little bit when they were just among their male colleagues. Uh, it was a little safer to do so. There's some real advantage to having male-only spaces, which we don't seem to have a lot of in our world currently. But the other part of that is I totally honor and respect. And it's a question that a lot of women come to me with is, hey, how do we get involved? How do we help here? And my response is education, by educating yourself is really important, but it's really important as well for women to invite rather than to teach, rather than to tell, rather than to direct. It's really important that women ask their son some questions, encourage a father to be participatory, to draw him out, to draw the child out, is a much better way to go than what some women who learn about these things in my class. They're so eager, they can't wait to go and tell. The problem is when that happens, a lot of men sort of get a little bit, they step backwards. And so by inviting and getting curious, tell me a little bit about this, getting curious about why their partner, husband, brother makes the choices that he does, rather than trying to tell him what choices he should make. That's really unempowering and not something that, and we'll find that men are more reluctant than to unmask, and they feel a little bit vulnerable and they get more guarded.
You've had some students talk to you before class or after class, sharing some of the impact that exploring these topics has had on their life. conversations that they've had with loved ones, perhaps, or even biases that they've kind of been unlearning. Can you talk
Hmm.
about that some?
Yeah. One of the biggest one is that every semester I have a few women that come into the class who have said, I came in, I was hurt in some way, or I came in very defensive, very uneasy about this class, and almost like like they want to fight. About this idea that why are we giving men any voice? Why are we putting energy into? And they come to me and say, wow, Dr. Rissman, I really didn't understand. I didn't understand what boys were going through. I didn't understand the challenges that men have. Everybody has challenges, but to finally give voice to instead of just assuming men are okay is really important. I have students come back to me 5, 10, 15 years later saying, Dr. Rissman, I was in your class. Do you remember me? Blah, blah, blah. Can I tell you a little bit about what I'm doing in my work? Can I tell you about the impact that it had? We had a conversation that changed my life.
Should we be surprised that there's only one university in the United States that has a men's health minor? Like, is that strange or is that about meeting the need that's out there?
It's not about meeting the need that's out there. It doesn't surprise me, but I'm also appalled. There is great need. Talk to people. At first, when I started talking to them, there was a little bit of, I'm not so sure. Now the conversation is, oh, my son, my neighbor, my nephew, my brother, not doing so well. Now people know what I'm talking about. They know someone that's representative of what I talk about, and they go, I get this. And I think that that's what's out there is we're starting to gain momentum on, hey, there is a mental health issue with young men. What's going on? So I really encourage and I hope that more programs like what I've created will show up. One of the things that I'm working on is men's health in medical schools, in naturopathic medical schools, as well as conventional medical schools. Do docs take a men's health course? No, absolutely not. So there's a great need right now for community programs focusing on men. University hospitals are creating lots of, these men's health clinics focusing on primary care and or urologic care for men. But where are the docs trained? They're trained in urology, but there's nobody who's teaching them about what is the experience of being a boy in our culture today. And how does that influence his behaviors? That's the missing piece of education.
I've written about how in Washington State we created in 2006 a Health Disparities Council. And there was an interesting debate that went on back then. The initial impetus for the Health Disparities Council was about addressing racial and ethnic disparities. And then concern for health disparities affecting women was added in. And then it was taken out because someone spoke up and said, that seems a little off track. And if we're going to be concerned with women's health disparities, shouldn't we be concerned with men's health disparities also? But then the women's health disparities concern was added back in. And so that's legislatively how it's been since 2006. And bringing about actual concrete change, to me, at least in the state that I operate, it still seems pretty slow. And I feel sad at times. And I wonder how much of it is just it's political and it's people not wanting to associate with certain things, and it's a lack of like a political social movement where there's enough people that are asking for change in this direction of inclusion for concern for men and boys and disparities that affect them.
Yeah, the word that comes to mind is fear. We have a great fear of trying to support and help men. There's a great fear of if I move to support men, it will look like I don't support women. When, as I said earlier, by supporting men, you're actually supporting women. You're supporting children. You're supporting the environment. You're supporting the animals by creating healthy men. We talk about what's happened politically. Are we not learning that one portion of our political system wasn't listening to men and they were um, welcomed into the other portion? But I'm hoping that people can see that it's really important that we listen because there is power in men. And if we are not paying attention to that, and if we're not paying attention to them, they're going to show it in another way. And I think this is what's out there is men saying, "Hey, please do not disallow my manhood. Do not disallow me being a man or make me apologize for it. Instead, utilize the benefits of being a man, being a healthy man." The hypermasculine behavior that we so fear is not manhood. That's a compensation for a lack of manhood. When we see these really overt hypermasculine gestures that we fear and therefore we legislate around, is because we're not really addressing what the the benefits of healthy masculinity.
I'm 38 years old, and I was married in my late 20s, from age 27 to 30, and I'm public about having experienced domestic violence in that relationship. My ex-wife turned out to have some behavioral issues and be prone to occasionally getting so upset that she would become violent.
Mm.
And this is something that you and I have discussed over email a little bit, and I wondered if you'd share about any ways in which you incorporate that topic into any of your classes.
Yeah, I bring it up. There's a study that was done here on campus many years ago. There was an event called Love and Lies that they did actually a survey at the time. This is 2006, I believe. And they were astounded by the number of men who talked to them about having been hurt physically, yeah, in relationships. And it was a little bit startling to see. I don't think I was startled by it because I had some education around this. It is startling for a lot of students, some of who get a little bit defensive. They really don't like hearing that men too are vulnerable and men too get hurt. I had seen documentary video. I had seen articles about men, even men in highly masculine, hyper-masculine kind of cultures, like but by police men who couldn't come forward because of the stigma upon them saying that they were being abused by their wife, and there was there remains a lot of stigma on that, and I think it's important to understand that it can be overt abuse like that, and it can be somewhat covert.
Are there any other interactions with specific students that come to mind that were powerful?
When I had that 18 men and 2 women first men's health class, there was a young man in the class, and I saw him on campus before class. I saw him getting into an altercation, and he was getting violent. He was really ramping up, and when he came into the class, wow, I'm really concerned about you. Tell me a little bit about what happened. And when I came to him in front of the class without calling him out and shaming him, I instead invited and encouraged, let's talk about what happened and your defensiveness. And it was transformative. It was absolutely transformative. It's how we speak with men because men are very afraid to be vulnerable. And when we go at them in terms of a shaming, you shouldn't, that puts them on the defense, and it is not inviting at all for them to come forward and own what their part is. At the same time, they need boundaries. We all need boundaries. But I see a lack of that right now. It is a conversation that I'm having more and more. Is really a lack of father, and I don't mean necessarily the man. I mean the father complex. What the role of the father? Somebody who sets a very strong anchored boundary, such that when a boy bumps up against that, he knows first of all, there's somebody there for him. There is somebody there for him, and he can feel it when he bumps up against that. The other thing is that young men need boundaries because ultimately there are boundaries, and you are not above that. In the same way, this idea that I'm talking to young men about, which they really struggle with, is don't strive for greatness. Don't strive for greatness. Boy, they really bristle at that because everywhere on the internet, all the health influencers are telling them, get bigger, get stronger. You need to do more. You need to be a little bit this way. You need to be that way. The delusion about greatness is that if I am so good, if I have achieved a certain amount, if I have amassed a certain amount, I can transcend boundaries. And I can transgress boundaries. I am free of the boundary. That's the delusion. It's as if I create, if I build wealth, etc., I'm not going to suffer. And so I really talk to men not about being great, but about being good enough. And I think that that's an important one that I'm really working at, trying to figure out how to have that conversation in a way that's palatable because a lot of young men hear, you know, don't become great. Everything on the internet is telling me I'm supposed to have a portfolio. I'm supposed to have a six-pack ab. I'm supposed to be big. I'm supposed to be successful. I'm supposed to have a trophy wife, etc. They're finding over time, we all know that those things all fall away. They all fall away. And what are you left with? So that's the conversation that I'm embarking on right now is this idea of don't become great. Strive instead to be good.
And also, achieving those things that you mentioned are not easy. And so, statistically, most people are unlikely to do that.
I can't tell you the number of young men who are coming to me in my practice with that depression because they tried to follow David Goggins or some of these guys out there. And what I remind them is that's their job. Their job is to look the way they look. Their job is to promote all of this kind of thing. But the truth is, we're human beings and we have some good things. We have some strengths, but we also have our weaknesses. And we all are not going to achieve those things. And if you don't achieve those, then as long as you're achieving what it is that you're really called for, what your why is, then you've been successful.
We were originally connected through Brendan Kwiatkowski. His company, his brand is Remasculine. He lives in
Mhm.
Vancouver, Washington, so just north of us here. And Brendan teamed up with me recently as a co-presenter at an event in downtown Seattle at a place called the Rainier Social Club. That was really neat for him and me to team up. And then very recently, he was down in Washington again as the main speaker at the annual Fatherhood Summit put on by the Washington Fatherhood Council.
I'm very proud of Brendan, the work he's done. He's just accelerated. I met him several years ago, and we had, he asked for a conversation, just wanted to know, he just wanted to learn a little bit about it, and he is just really, he's just really found his stride. He's found the need for his voice, for his training, for the way he's able to talk about these very sensitive topics.
Is there anything else you'd like to share about what's to come for you at Metropolitan State University of Denver and your work in men's health?
I'm starting to train and prepare younger men to come in and do this work, to take over, if you will. I'm no longer the warrior, the one that's doing the work, but I'm rather the next phase, which is the master in the grove of elders. The idea that I now advise. I help other people to achieve what their goals are, to help them to become the workers doing the next generation doing the work. Men, as they age, have this strong sense of denial that decline will happen. And the truth is, none of us escape that. And instead, to try to figure out what is my role as I evolve? What is the next thing that's out there for me? And it is not simply retire, play golf, but rather there's still need for me.
Outstanding. Wow. Well, I'm really grateful to have met you and to have been in touch with you, as well as to benefit from your support, your encouragement, your guidance toward me. It's an outstanding life that we're both living, I would say, with a lot of adventure when
Yeah.
you're kind of trailblazing.
No doubt. I am a very fortunate man to be able to do what I do, to be able to have found this. Paying attention to the clues that had been left along the trail that I made sense of, that I went, oh, I get it. I get that what I'm supposed to do next. I was able to find myself, and I'm at a place in my life where I am at a significant bloom, that I am at a place of heightened purpose, a heightened sense of who I am and what I'm able to do.
And your
But
influence.
it wasn't always that way. Thank you. Yeah.
But it wasn't all that. Yeah, that's a useful thing to point out to our younger population, especially. It takes time and it takes work, it takes persistence. You can get there.
You can get there, but the importance is not to try to become great, but rather to do what's in front of you, because that's all ego based. And what we really need is the slow process. We take the stairs, not the elevator.
Well, why don't we conclude for now? This has been
Okay.
marvelous.
I'm always happy to come back and talk more. I want to say that I think your work is amazing. I use a lot of your work, your posts in my men's classes, and because they're relevant. So I really appreciate your work is so necessary. Thank you.
Thank you very much.